Welcome to Music and Medicine on Monday, a collaboration between the School of Music and the College of Medicine here at the University of Iowa. This podcast is designed to help musicians play and to stay healthy. Today we're expanding to discuss music as medicine, introducing a series addressing the profession of music therapy. This video is supplemented with more written detail online through the Iowa Protocols, a free medical website. You can find that resource at the QR code or the website address displayed. We're coming to you from the recital hall at the beautiful Voxman School of Music here at the University of Iowa. My name is Harry Hoffman, and I'm a physician at the University of Iowa. Our featured student guest is Naomi Davis. She is a first-year PhD student in music therapy. Naomi also completed her master's degree at Iowa and is an active music therapy clinician, songwriter, and performer. And with that, Naomi, can you tell us a little bit about your background, how you chose music therapy as your profession and your clinical work?
Yeah, absolutely. So I have been a music therapy clinician for the past 4.5 years or so. And I primarily work with children and teens in school-based settings and community settings. So I primarily work with children with disabilities and developmental disabilities in school-based settings, as well as teens and children with persistent mental health needs in community and telehealth settings. I have been a musician my whole life. I grew up in band and playing the bassoon, and I always knew that I would have a profession in the field of music. However, I started to feel like I wanted to be able to do something that had a little bit of a wider scope in kind of how I can engage others in music. And when I was in high school, a close family friend had a stroke, and she was receiving a variety of therapies, including physical therapy and speech therapy, to work with some of her speech aphasia. She was feeling really discouraged and wasn't making as much progress as she wanted to. So her physician recommended and referred her to receive music therapy services, which was the first time I ever heard about music therapy. And hearing my family friend's experience in music therapy and really seeing how hopeful she began to feel about her treatment in collaboration with the music therapist and the speech therapist was really eye-opening for me. And it opened up a whole world that I didn't know was available to me as far as how I could move into a profession in music. So I got to shadow that music therapist as well as other music therapists in my area who were working with children, which is something I always knew I wanted to do. And I haven't looked back since. So I've known I wanted to be a music therapist since I was about 15 years old and took that path straight to where I wanted to be, which is here.
So terrific. So music therapy is the focal point of your career,
Yes.
But it still allows you to perform?
Yes, and I do. I love writing music and sharing music with people in a way that's a little bit more performative and personal as well. And so I've gotten the chance to continue to perform music in the community, playing events, things like that. And so that has been a really fulfilling way to fill my own cup musically.
So you're playing professionally as well as working as a music
I am,
therapist.
yes.
Terrific. Well, today we're going to provide a basic introduction to the profession of music therapy. This is a healthcare profession in which clinicians use music within a therapeutic relationship for a variety of healthcare and educational goals. We will discuss how music works as a therapeutic modality and how music therapists are trained. With us today are several music therapy faculty members, including Abby Dvorak, an associate professor and director of music therapy at the University of Iowa. Before completing her PhD and joining the faculty at Iowa, she was a practicing music therapist at the University of Iowa hospitals and clinics, both in behavioral health and in cancer care. Her research focuses on therapeutic uses of music for mental health. Kate Gefeller is a professor emerita in the School of Music and the Department of Otolaryngology. Her research focuses on music therapy and hearing loss. Kate was director of the Iowa Music Therapy Program prior to her retirement and continues her research in the Department of Otolaryngology. So, Naomi, you're sharing some music that might be used in a music therapy session. Can you tell us a little bit about this music, the type of client who might benefit, and your musical choice?
Sure. So I'll be playing a song called I Am Light by India Ari. And something that I love about music therapy is you can use any kind of music with many different settings and different folks. So I've used this song in like more mental health and wellness settings with teens, and we used it to kind of discuss like themselves and how you're not just your circumstances and the things that have happened to you, or maybe even the challenges that you face, but who you are inside can be full of light. I've also used this song with preschoolers. I rewrote some of the lyrics, and we've focused on how you can be a community helper and be a light to the people in your life, like your friends and your family. And we moved to this song with scarves. So one of the lines I changed to be, and now we'll raise our scarves and wave our scarves. And that's kind of the direction that they needed, as well as the lyrics. So it can be used in a lot of different ways, and I've used it in a lot of different ways as well.
Terrific. I can't wait to hear it.
The things my family did. I am not the voices in my head. I am not the pieces of the brokenness inside. I am light. I am light. I'm not the mistakes that I have made, or any of the things that cause me pain. I am not the pieces of the dream I left behind. I am light. Oh, light. Not the color of my eyes. I am not the skin on the outside. I am not my age. I'm not my race. My soul inside is all light. Oh, light, oh, light. Oh, light. I am light. I am light. I am light. I am light.
Fantastic. That was beautiful.
Thank you.
Naomi, I understand that you wrote a song that you'd like to perform for us. I'd like to hear more about its inception and where you use it in the context of your performing in therapy.
Yeah, this song is a really simple song that I wrote for some preschoolers who are having some really big feelings, which big feelings are okay, but sometimes our reactions to big feelings are what we need to learn new ways of expressing our feelings. And so this is a self-regulation tool that I recorded for a lot of the classroom teachers that I worked with. And I also used in sessions to practice the skill of being able to take a deep breath, count to 10, and start again. So it's for preschoolers. It's simple. It doesn't have a lot of words, but we can use cueing in the music and the lyrics of the music as a prompt to take a deep breath and count to 10. It's called Breathe.
When I'm feeling frustrated and a little upset, what can I do to get calm again? I take a deep breath and count to 10, and then I'll keep going. So come and breathe in, breathe out, breathe in, and then I'll keep going.
And then we would just repeat it. So it's really simple, not a lot of words, but lots of opportunities to practice that skill of breathing in and out. And when I give this to teachers, that's a recorded version. The counting is in the song as well, and it's not just me. And the breaths, the prompted breaths, are also in the recording, so they can use it in their classrooms.
Abby, can you make some comments about her performance and how it can really work for a music therapist?
Absolutely. Naomi's song Breathe was a great example of songwriting for clients, where we provide live music interventions in the moment, and we also can provide products such as recorded pieces of music so they can practice outside of the music therapy sessions. I love how the song elements were such that it helped relax. It was slower. It was very calm. You could manipulate it to be faster or slower depending on the needs of the children. You can also increase the volume of it to be a little bit louder in case they're rambunctious in the moment, and then start to calm them down by playing softer. So there were lots of elements in there that were really helpful, especially the lyrics, because that really prompted the breathing in and breathing out so they could practice it in the moment. And that's a great example too, all of these things of the ISO principle, where we match where our clients are at right now, and then slowly through the therapeutic elements of the music, we can manipulate them to a different way of thinking or acting or behaving. So to go from excited and rambunctious to slightly calmer through this process of breathing and listening to the music.
That's a nice description of the ISO principle. Is there a definition you have of ISO principle?
The definition of ISO principle is really just what I mentioned, matching the mood of a client in that moment, and then using elements of music to help move them to a different mood state. So it could be stressed or upset, angry, mad, and then whatever a mood state is that they want to be in, such as relaxed or happy or calm.
So Kate, is that a cornerstone of music therapy, the ISO principle?
Yeah, absolutely. I think one of the things that was so obvious in Naomi's performance here was, in fact, I think performance isn't quite the right word. I think music therapists use music. They have beautiful performance skills, but they are really more interactive. So for example, Naomi would be keeping an eye on the people she's working with as she sings, and she's looking for responses from them physically. Are they relaxing? How are their facial expressions and so forth? And a good music therapist who's very musically adept also is a great observer of human emotions and behaviors. So a music therapist can change right in the second to be in tune, literally, with how the clients are and what they need. It's not about, I'm a great singer here, but it's about, what can I provide for them that will help them to have a more satisfactory experience, to be at their best as human beings.
Now let's go back to your first performance, I Am Light. Abby, can you comment on Naomi's performance and its role in music therapy?
So Naomi's facilitation was just beautiful of that song. That is actually one of my favorite songs too. So that brings me to this idea that many times in music therapy, we use client preferred and familiar music that's pleasurable to the client, first of all. The lyrics of that song were particularly meaningful, and it helps people relate to others, to connect to others, and to realize they're not alone in what they're feeling. It also helped prompt this idea that our internal state, that we are light, we are a wonderful person in this universe, and it's not so much about the external or our circumstances in the moment. You did a nice job of manipulating the live music too. You could speed it up or slow it down. You could do lots of different things with it. You were very effective in being flexible and creative in how you facilitated that song as well.
Kate, can you comment on choice of songs for your audience? I suspect that was a great song for this audience. There's other audiences you might choose something different.
Yes, and in fact, one of the things that I think is very important is that the music therapists take into account who they're working with and what are their key issues they're working on right now. So for example, even if you're working with a group, the group may have certain things that they share in common. Or if you're working with an individual, then you really want to address where it is that they're at right now. With that particular song, I think there are so many ways that a person could say, that person who wrote that song knows exactly how I feel. And my experience as a music therapist is people will oftentimes start to share how they feel about things in response to the music, when before they've been a little bit closed off or a little bit uncomfortable sharing how they feel. So the music can actually, I think, really encourage them to feel safe and comfortable in sharing those kinds of feelings.
And I really like that idea too, if I can add to that, that when you are facilitating that song, you could do lyric analysis where you discuss the lyrics. You could also do singing where it can help bond people and help us express our emotions. And I love too that you could do some type of movement with that where you can slow it down or speed it up to help prompt some different stretching movements or flowing movements depending on what you were trying to do.
So one of our goals is to use this session to expose the world to the spectrum of music therapy. And with that, I'll turn it over to Kate to try to give a broad perspective on all the things that music therapy can do.
Well, we've kind of gotten some nice examples from what Naomi has shared with us so beautifully. Abby, can you maybe put a little bit of structure around that and talk a little bit about how and why music can be such a powerful therapeutic medium, and also some of the factors that a music therapist would take into account when they're trying to decide which music to use? And let me ask, can there be music that is not appropriate in music therapy at any given time?
So those are all wonderful questions. And if I can just start with a definition of music therapy. Music therapy is an established healthcare profession where we use the clinical and evidence-based use of music to help our clients meet their goals within a therapeutic relationship. So those goals can be many different things for our clients. When you think about music, it's a very complex stimulus. And so therefore music processing is also going to be very complex. It starts with these sound waves in our environment. It goes through our outer and middle ear into our inner ear, where all of those vibrations are transduced into electric signals that go up our auditory nerve. They go through the brainstem, the thalamus, and into the auditory cortex. All of that means that we can process music into subcortical and also cortical levels. So we have some things that happen at the subcortical level that are just reflexive and they don't need to be learned. That might be something like we have our attention drawn to sounds in our environment. We put our gaze there, we put our attention there, which means that music affects our cognition at its basic level. We also have neurons that connect to the amygdala, which involves emotional salience in the environment, trying to figure out if this is something that is going to help us survive or if we're going to be in danger. And so we have this connection through music to our emotions at the basic level. We also have neurons that go into our motor areas of our brain, so at cortical and subcortical and cortical levels. So we have this auditory motor coupling that happens, which allows us to entrain to an external auditory stimulus in our environment. That's how we can walk and dance to music, even without being fully conscious of doing so. Then the neurons connect to many different parts of our brain so that, within networks across networks and across hemispheres, we have these connections to music. If you think about it then, music, it makes sense. We can affect motor, cognition, communication, sensory, emotion, and social aspects of functioning in different ways. We also keep in mind too that music is effective because of this interconnectivity across neural networks, but also neurochemicals. Music in our environment can affect things like reward, motivation, and attention. And think about dopamine that's released. That helps us learn, it helps us remember, it helps us move, and it helps us with our mood. We also have areas that are affected by stress and arousal, so that can affect cortisol. Music can help us relax then. It can also be stressful, which I'll get to the last question you had about harm. Music can also affect social bonding. So we have this thing called oxytocin. We usually think of it in terms of maternal behaviors, and as one of my students called it the other day, the love hormone. But really, it helps us bond with other people. And so doing group music experiences and singing, performing, all of those things can help with us feeling closer together, and it can release some of the really important neurochemicals in our body. The last piece that's really important, besides that interconnectivity, the neurochemicals, is neuroplasticity. And so that's the brain's ability to wire and rewire, and for us to learn and to move. So many times in music therapy, we might help our clients learn or relearn information and help, in some cases, to rewire the brain to detour around some areas that are affected by different conditions and diseases. So music, as you can tell, is very therapeutic in many different ways, and it's a complex process. But our clients can benefit from our educated and trained music therapists. We want to make sure that we have that education and training to avoid harm, because music can be harmful. If we think about music stimulus itself, we might have music that is too loud or too fast. And so for some of our clients who have sensory processing challenges, that can be overstimulating. And of course, we have a negative stress response as a result. We might have people who are not trained and they put headphones on people and have people listen to music for hours at a time. And that's not helpful either. We start to habituate. It might be music that's triggering to the client, and it can be very harmful. So there are lots of different ways you can use music that are not helpful as well. And so that's why we need to have very educated, trained specialists, as we are in music therapy. Did I forget a piece of the question?
Well, I think you've done a wonderful job of addressing a number of things. I just wanted to mention, I remember collaborating with a speech-language pathologist in a session with young children, and one of the things that she said is that they like to call music therapy sneaky therapy because the kids are so engaged and the music feels so natural. There are all these wonderful things that are going on in the body, in the brain, and in the heart and soul, but the person doesn't even actually think of it that way. And consequently, the motivational part and the part of connection really matters. One of the things that you started to talk about a little bit, but I think maybe you could expand on it just a little bit. You talked about how important it is to use the right kind of music. To me, this kind of gets at one of the differences between how we might enjoy a wonderful concert or a wonderful recording versus music therapy. I think there's some overlap, but can you talk about some of the differences between those things?
Absolutely, that's a great question. With music therapists, we are focused on our treatment process, and so through a referral, assessment, treatment planning, evaluation, documentation, we identify what our clients' needs are and how we can use music to address them. In our performance aspect, we might just have any music that we're listening to. We may or may not enjoy it. We can turn it off, we can turn it on, and so forth. In music therapy, it's a strategic use of music to meet those needs. So if, for example, we have somebody who is working on ambulation with walking, we might want to use preferred music that's a certain tempo to match the walking pace. And then depending on their needs, we might manipulate the music to be faster or slower, steady, and so forth. With music, when we think about the choices that we make in therapy, we want to make sure that we have music that's considered pleasurable, pleasant to the client. We want to make sure too that if we can, that it's preferred music of the client, because we have a different response in our brain associated with stress and arousal. So that type of music has a different response than music that might be unfamiliar or unpleasant or unpreferred.
Maybe I could ask Naomi a question you could amplify on further. So music as medicine, you think of disease processes that you're treating with medicine. What are the disease processes you would target with your music therapy?
Yeah, that's a great question. I think music therapy is so wonderful because we can use it with folks across the lifespan. I have worked with young children with developmental disabilities such as Down syndrome or Williams or Rett syndrome even, as well as teens with persistent mental health conditions like bipolar 2 or adults with schizophrenia. I also have colleagues who work in hospice settings in end of life, and music therapists who work in the NICU with neonatal infants and their families as well. So I think there are a lot of the symptoms, like Dr. Dvorak talked about, like communication and social skills, enhancing and working on social skills, or expanding spoken or non-spoken communication tools that are available to young children who may have disorders like autism or Down syndrome, as well as working on like comfort and physical relaxation and wellness in like hospice settings and things of the like.
There's been a lot in our medical literature about using music as an adjunct in managing pain and the anxiety that goes along with pain. Kate, do you want to discuss that a bit?
Yeah, so if you're thinking about working with someone who might be in pain, either one of you, I'm imagining a situation where you're in a palliative care setting and you have maybe a gentleman who is a Vietnam vet and he really loves headbanging hard rock music, but he's in a lot of pain. And so his preferred music might be, really heavy, loud, crashing music, but maybe he can't tolerate that. What does a music therapist do in that kind of a situation?
Go ahead.
Yeah, I would say one of the things that we can do is adapt a preferred song.
Okay.
So if someone is really into AC/DC, we're not going to be bringing an electric guitar into a hospital setting where they're in intense pain for many reasons, but we can take maybe a preferred song and kind of strip it down to some of its base elements, the lyrics, or maybe the melody. And I might bring a nylon string guitar and create an arrangement of the song that is quieter, like lower decibels, because we don't want something that's going to be too loud and raucous. It might maybe not have words. I might just hum a melody rather than singing the melody, but keeping some of the elements of that song that they're drawn to and kind of stripping it down and toning it down to serve the goal that we have.
And this is one of the real advantages of a music therapist who's a very flexible musician, because as I said before, you can look at the person, you can see how they're responding. A tape recorder or a boombox cannot change to meet the needs of the client. But a music therapist who's very well prepared musically and clinically can do that. Also, sometimes back to the thing about music being potentially harmful, I worked for a period of time with individuals who had problems with substance abuse. And there are a lot of songs out there that in fact kind of make using drugs sound pretty glamorous and so forth. Those particular songs might trigger an individual, and so what would a music therapist do if they wanted to listen to that kind of music? What would be some ways you'd handle that?
That's a great question. It probably depends on where they are in their treatment process. Somebody who is initially trying to go through detox and who is really struggling at that moment with substance use, it could be that at that moment they don't listen to those types of songs, and we discuss why. They might look at healthy and unhealthy uses of music, that sometimes we get stuck in a certain song and that can exacerbate some of those negative emotions and those feelings and some of the behaviors that they might be experiencing or wanting to experience. As they go farther along their journey in recovery, eventually they might want to start bringing those songs back in to talk about them and talk about some of the experiences they had and children, how they have hope and are looking forward to the future.
And
It can
maybe
also-
learn to not get triggered.
Exactly. So it can be that they start to re-listen to those songs with a different perspective and a different focus. And it might not have the same triggering effect as it might have earlier in their process.
Now, it seems to me that this ability to use music very flexibly and to check or to be able to play things that the person loves requires an awful lot of musical flexibility and also a deep and broad understanding of different musical styles and genres and so forth. So, how is it that a music therapist will be sufficiently prepared to do that kind of, I'm going to call it musical magic, and also deal with the clinical things of knowing what are the physiological, psychological needs of individuals who have a variety of different either educational, social, or physical needs? How does a music therapist prepare to be able to bring together those two parts?
So every music therapy program is approved and reviewed by the American Music Therapy Association. So we have a variety of courses that we need to take. So we have music courses, first of all, that would be music theory, music history, music lessons, music ensembles. We also we need to know the mind and human behavior. So we take a variety of psychology classes, including developmental, abnormal psych, and so forth. We need to know about the human body and its systems, so we take human anatomy and physiology. We also have music therapy courses where we have conceptual knowledge, so we learn about music therapy approaches, methods, interventions, techniques. We learn about different populations and their needs. We learn how to work therapeutically with people. We also have practical skills where we go out and work with community members in a variety of ages and populations, and we learn how to work with children, adolescents, adults, and older adults in different types of facilities with different theoretical approaches. So there are lots of different components to a music therapy education. After our education, we get to do a 6-month internship, and those are approved through AMTA as well. They can be national, and we have some international. After that 6-month internship, people are eligible to sit for the board certification exam, and at that time, then they would have the designation MTBC after the name, Music Therapist Board Certified. You wanted to add a few things,
I was just
too.
going to say, students who come to study music therapy begin as musicians first, in whatever way that looks like. We audition to get into a school of music, but I didn't play the guitar at all, or very little piano, and I had never sung in public before studying music therapy. And so we come in with some amount of music training. For me, it was bassoon and some other classical styles of music. And then we learn a lot about different styles of music and the history behind some of those styles of music, especially popular styles of music. And we learn how to play the guitar, and we get more comfortable with our voices if we haven't sung before. So we get a lot of really in-depth education in some of these instruments that we do need every single day in our career. And it can be challenging because you're learning a lot of new skills all at once, but it's so great that we do have the music therapy coursework that really helps us to bridge the gap and between these fields. So music and psychology and neuroscience and physiology and how they work together and how the puzzle fits together.
Abby, in your description, I didn't hear mention of study of specific disease processes like Parkinson's and dementia. Does that come during the 6 months of the internship, or is that something that's part of the curriculum or should be part of the curriculum?
It comes as part of the curriculum and in the internship. So that's part of the conceptual knowledge is learning about different ages and populations and some of their needs. So disease processes, conditions, and so forth, and how we can use music to effectively help in many different ways.
Yeah, so it seems to me that music therapists get kind of what I'm going to call a basic background in basic physiology, basic anatomy, basic psychology, and so forth, but then they also learn about applications with specific types of populations. And so music therapists get kind of a generalist background, but oftentimes they will develop a specialty as they go along. For example, I specialize in working with individuals who have hearing loss, but I spent 10 years working in a psych facility. So I spent a lot of time working with individuals who had similar situations to those you work with.
Absolutely. And with music therapy student development, we find that, as Naomi mentioned, we have this kind of core musicianship that develops early on. We also have influential people, such as mentors and scholars and people in our environment like piano teachers and parents and so forth that tell us a little bit about music therapy. We have then this idea that we come to music therapy and we choose it as profession, but we are, in many cases in different programs, generalists, like you said, where we learn a lot about a lot of different things. But as we go through internship and as we have our first work experiences, we start to develop kind of interests and motivations in particular areas. So then we might have more training and education and research that we do in a particular topic or particular population with which we work.
Great. Well, thank you, Naomi, Abby, and Kate for this introduction to music therapy. We will have other sessions that will address specific disease processes and other uses and applications of music therapy. Additional detail regarding this and other episodes of Music and Medicine on Mondays can be identified by visiting the Iowa protocols through the QR code displayed, our website address, or simply by searching on the web for Iowa Protocols, Music and Medicine on Monday.
I'm not the mistakes that I have made, or any of the things that cause me pain.